I'm delighted to welcome this distinguished group of speakers. We want to talk a little bit today about our health innovation systems and how things are moving along in that area, as well as specifically here in North Carolina. So I'm going to let each person introduce themselves. As Ashley so kindly mentioned, I'm Sara Garces Roselli. I'm one of the co-founders of RevTech Labs. And to my right is Paula Kranz. So why don't you start, and then we'll go down the line.
Yes, good morning. Paula Kranz, Vice President of Innovation Enablement and Executive Director of the Novant Health Innovation Labs.
Thank you.
Sally Frank, Worldwide Lead for Health and Life Sciences at Microsoft for Startups.
Tracey du Laney, Senior Director of Science and Technology Development in North Carolina Biotechnology Center.
And Dave Kaiser, the Deputy Director for the Office of Science, Technology, and Innovation at the North Carolina Department of Commerce.
So you can see we have a lot of experts on this panel who are dedicated to accelerating innovation. And our doctors before us talked a lot about some of the barriers and pitfalls to that. So really just want to talk a little bit about where you all think the current state of healthcare innovation is. We've heard so much over the last day and a little bit about this topic, but where you sit, what do you guys think about where it is today?
I'm happy to jump in. So I think first, if you look from a global landscape, and I'm sure Sally can talk about this, there's so much excitement, so much investment going into the global healthcare and health tech space. Regionally, we see a lot of investment as well. Charlotte Regional Business Alliance just put out a report that indicated we're in the top 10 cities in the nation for health tech, for life sciences investment. We've got 20,000 jobs alone in Charlotte that are focused on healthcare. So there's a lot of opportunity, a few shortcomings as well. Mm-hmm. So that's kind of our region. And then I would say in the Novant space, we've really, under the leadership of Angela Yoakum, our Chief Transformation and Digital Officer, created a space that we are, in spite of the challenges of operational constraints and COVID and so forth, still continuing to move innovation forward. So I look forward to talking about that a little bit today.
That's great. Thank you. Sally?
Yeah, I think from a technology perspective, I think I can add that there's a tremendous amount of work using AI and machine learning, and I think we're all keenly aware of that. But I also think there are opportunities that are perhaps a little bit less high tech. Things like just working on automating workflows and getting the opportunity to free up staff from mundane kind of tasks. Mm-hmm. So I think when we look at it from a technology perspective, we've got kind of the low-hanging fruit that are automation and things that help with patient and staff workflow. Can you still hear me? Oh, there we go. But then on the opposite side and everything in between, we're doing really advanced things with DICOM and with machine learning, and how do we augment the human experience, the human expertise with automated results and things like that. So lots of exciting things going on depending on where you are in that technology journey.
Tracey?
So healthcare technology is pushing so hard right now. There is so much excitement around AI and machine learning and all the new things that you can do. But the problems people are running into is getting into those healthcare systems and getting out onto the market and proving that you're better than what's already out there. And there's a wall there that people don't want to have to incorporate some of these technologies, or it's difficult to incorporate. And we just have to make that a ramp instead of a wall.
Yeah, for sure. Dave?
Yep. And from a macroeconomic perspective of North Carolina, when you look at R&D expenditures relative to overall state output, the private sector in North Carolina alone is about 11th in the nation in terms of driving overall R&D expenditures and innovation. And then the other side of that is, of course, our academic side, our universities, which I think, according to the report that my office published, is 5th in the nation. And so we've got drivers on both sides pushing the economy in this, and digital space is one of those. And a lot of that growth is driven by our metro areas, Charlotte, of course, the Research Triangle Park, the Triad, Asheville, Wilmington, and so forth. So overall, the state of healthcare innovation is really, really strong.
Just to add one more point, Charlotte is the 7th fastest growing city in the nation. And with that is coming a lot of tech talent from New York, from California. It's a more affordable place to live. There are more and more jobs. The growth in AI jobs alone has been 355% since 2017. So there's a lot of demand for that talent. There are 4,000 degrees granted in the health tech, life biosciences space a year in the Charlotte region, CPCC, UNC. So the talent is here, the companies are moving here. We've got investment from Eli Lilly. You probably know how much that investment was, creating new jobs and demand for that talent. So kind of this matchup of talent and demand is happening as well.
So as we talk about some of those challenges and knowing that there's this catapulting growth in innovation, and then on the other side, as we heard from our doctors before, there are a lot of challenges with innovation, health systems. How do we invest? How do we adopt that? So talk a little bit about some of the challenges to this growing ecosystem. And maybe, Dave, you can start this one.
Sure, I'd be happy to. I think there's three things you need really to kind of keep it going. It's, there's I can't remember who said it, what got you here won't take you there.
Yep.
So it's going to be a constant need of resources to keep and momentum to keep it going, both from the private sector and from the public sector. Capital, of course, is one of them. So like my office, for example, we give grants to companies that receive federal small business innovation research or small business technology transfer awards. North Carolina is one of the first states in the country to offer these types of matching awards for these companies. And so when these companies win these federal awards, all of that, the prototype development that they're doing, they basically run out of grant funds and they say, well, the money is dried up. What happens next? And so the Department of Commerce comes in and says, don't think about moving to Silicon Valley. Don't think about moving to Boston. Stay here in the Carolinas. We'll develop you. Basically to put you on a path towards commercialization. Tracey here is the exact same thing, but on a much bigger scale through the Biotech Center. That's one piece of the puzzle. I think you need to have continued institutional support behind it as well. And then, of course, and that could be your universities, that could be your local and regional players that all have to get behind kind of the set goals of driving and making innovation a forefront of economic change and development.
Do you want to talk about that, Tracey?
Yeah, so a lot of people don't realize that the Biotech Center is in the resources business. That's what we do. We provide grants to universities to get those fantastic ideas out of the universities and into the market. We provide startup loans for small entrepreneurs so that we can get you ready for the SBIR so that he can take over and get that funding continuum. But we also offer just a wealth of resources available to every citizen in North Carolina. And I'm always pushing, go to our website, see everything that we can do for you in the life sciences to do your small business here in North Carolina. And beyond that, it's really get to know your ecosystem, get to know the people in Charlotte, get to know who's who among your local people as well as at the state level. And especially at Novant, where they're pushing, they have the offices to do technology and to do innovation. Really get to know them.
I guess that's an open invite. Come on over.
Yeah, I think from my perspective, running the program for Microsoft for Startups in Health and Life Sciences, we are trying in a global way to ensure that we democratize the ability to innovate. So if you are sitting at your kitchen table and you have an idea about something that you want to fix, or a company or something like that, you can go to startups.microsoft.com, sign up, and start getting access to cloud tools, to tools to run your business, and go to market support. So what we're trying to do is make it incredibly easy for somebody with an idea to find the tools and the assets that they need to start building a company. And so when we think about how we want to do that, we really have three objectives. One is to try and be the strategic technology choice for early stage companies. Two is to try and help startups at every stage of their journey. So what you need when you're sitting at your kitchen table is different than when you're building your MVP and beyond. And then the third thing is to try and do our part to make sure that the startup ecosystem more accurately reflects the world in which we live. So these are the tenets by which the Microsoft for Startups program runs, and we are doing what we think is a good job and continuing to evolve so that we are able to find and support startups and founders at every stage.
Love that. And we partner a lot just because, as you said, it takes a village, an ecosystem. We have found we can't do it alone. We can tech scout and find a company, but oftentimes they don't have the resources. So we've pivoted to say, Microsoft, go get these Microsoft resources. Let's, talk to NC Biotech about getting a grant, and then we can collectively bring this to fruition. So one thing we've focused on is that building the North Carolina ecosystem, trying to incentivize partnerships with local companies. They often leave to go find funding elsewhere. That's a challenge I'm sure we'll talk about today. But it's one of the challenges from my perspective. If you don't have an advanced enough MVP, our team just does not have the bandwidth, nor does Atrium, nor do other healthcare systems right now, or they're just trying to keep the lights on. We can't really help you with that 18-month path. And as a startup, it's not worth your time and money, right? So
we can help.
So go see Sally. So we've kind of pivoted to a little bit later stage that has a proof of concept. And we've pivoted to finding external partnerships, global partnerships, Nordic Amplify, Enterprise Ireland, the Israeli Innovation Authority, and so on and so forth. And Matt Floyd is here today. He's helping us build an innovation nexus where we're partnering with those foreign governments who give financial backing to these companies so that they can come and get into the Western market. So we've also tried to focus on empowering our own employees. And part of our mission statement talks about being relentless about unlocking human potential. We have to be doing that with this whole ecosystem. But our new lab is now a place where we can inspire that creativity, lead them through design thinking. Most people haven't been trained in engineering and product development,
Absolutely.
right? So we have to bring those resources to them and make them feel empowered to get to the finish line.
I think that's a really good segue to kind of continuing the theme that you brought up a little bit, Sally, around democratizing innovation. As we think about, the work that we're doing here in Charlotte with RevTech Labs, with all of the organizations at the state, at the local level, at the healthcare system level, all of us are trying to achieve that goal of really democratizing innovation, not just from a purely, idea level, but also at the capital level. So I want to talk a little bit more about how each of your organizations are doing more of that. And it's wonderful to hear that Microsoft has so many resources. But one of the things I've heard most entrepreneurs talk about is, how do I get access to these things? I don't know about all these things. And I think we don't do a great job in the marketing of ourselves to really talk about that, to make it more democratic. So I'd like to hear a little bit more about that democratization of the innovation process.
Who wants to start?
I'm happy to start again.
Go ahead.
All right. Yeah, that's something we think about constantly at the state. In addition to the role I play in my office, we also provide staff to the Board of Science, Technology, Innovation, which advises the North Carolina Governor and the General Assembly on all things science, tech, and innovation related. This is the forefront at their helm, is the democratization of it. And I think for the beginning of our thoughts and discussions, it's all about access and making it as equitable as possible to get access not just to the entrepreneurs in Charlotte and the park and so forth, but across the state. And one of the ways we've done that specifically is through our grant program, the One North Carolina Small Business Program. We've provided additional funding levels to companies located that are just outside our metro areas. We know our metro areas are strong drivers of innovation, but getting those gains from innovation to spread much more equally across the state, to better drive access, to create more growth, and to create more entrepreneurs and more innovation statewide, we're giving more funding to those regions as a result. We're also engaging in kind of an education and outreach effort. The board's very first time at doing this in its 50-year history, to make known the information about those resources. Not just the resources that we offer at the state, but the resources of the Biotech Center, the resources of RevTech Labs, the resources of NCID, who's one of the sponsors here, and so forth. A lot of key players. Because I think when you talk about democratization of it, it starts with access. And that's what we're trying to do.
That's great. Thank you.
And the Biotech Center is all about access and democratization. We have the resources that are available to anyone in the state. We have an office here in Charlotte. We have regional offices throughout the state. We serve Cullowhee to Wilmington and everything in between. He laughs, but we really do. And if you don't know where to start with the regional representative here. Corey Curtis, she's phenomenal. She knows the region. She will link you into our library services. We have market research reports to do all of your competitor analysis, to do your market research. It's free to anyone in North Carolina to access those market research reports. And you can do it virtually now. You don't have to come to our office and actually sit in our offices. You used to. You actually had to make the trek. You don't anymore. But it's through that, resources like that. We are also a convener. We bring together people who ask or who have a need, and we can point you to your contract manufacturer who has your specialty plastic that you need to make your thing, or who has a 3D printer available at a university that makes your very, very specific widget that you absolutely need. We are the linkage, and we try to serve the entire state through pointing you to the resources that are available to you.
Right. So I kind of started the topic with democratization, but one of the things I wanted to point out is that Microsoft, like other cloud providers, you expect to get access to technology and tools and things like that. But one of the things that people don't understand about Microsoft for Startups is one of the things that we try to do is to help our startups grow, not just consume our tools, but to actually grow. And the way we do that is by getting them connections with our customers, like Novant, so that it's not just all about the technology and building the MVP and the product market fit solution, which is great, but then what? Well, if you're going to sustain yourself, you need business, you need customers. And that's one of the things that we're also trying to bring, so that we're not just shoring up the technology side of things, but we're also helping on the business development side. And so when I think about democratization and what Microsoft for Startups can bring, we try to do our best to bring a holistic approach to helping that startup grow and scale and remain in our ecosystem forever, or until they're acquired, or whatever the exit strategy is. The other thing that I'll point out, because a lot of people don't know this, is that we don't take equity. We do have a venture arm that does that, but what we're doing is really trying to build that startup ecosystem and build the next unicorn or the next market maker, both from a technology side and from a go-to-market business development side. So democratization across both of those key areas for successful development of a startup.
I think you should use a recording of this as an advertisement for getting companies to move to
Absolutely.
Charlotte. It's really exciting what's going on in all of your sectors. I will say that we have been talking about democratizing innovation as well. It's definitely a buzzword. Every one of my LinkedIn posts has it. It's part of our mission statement. And I think we're doing that in a few ways. One, we have a very intentional mission to educate our workforce. So there's access, but education, right, and exposure. So we bring in emerging tech in our lab. If you came last night, you saw some of it, but we have new tech in the acute space. We have things we're deploying in the hospital at home space. We have an immersive alley with all sorts of augmented, virtual, and extended reality, and then 3D printing and other visualization tools. So most of our workforce hasn't seen this before. They're too busy with their head down working to get the job done. Second, I will say thanks again to Matt Floyd for leading that exhibit. Second, Lindsay Court is here, and she does so much for our team to reach out to the community, even down to like the 5th grade level, Smart Girls HQ, and trying to get girls and boys at that young age interested in STEM careers. She's also helping lead an initiative called Bridges to Healthcare, so engaging with colleges that have students interested in this field or who don't know what they want to do. Let's expose them, get them loyal to our brand, just show them what the future holds in that space. And then, we're working with corporate partners. Sally and I were just talking about a program we're launching. It's an executive in residence program. So I don't come from healthcare. I came from the military, so I just didn't understand the language, how things work. And I'm always like, why don't we do it the way we did it, in special operations? Well, because you need to understand regulations and how healthcare works. So if we can expose even executives to how our innovation works, how our healthcare system works, then we've kind of touched a lot of points in the ecosystem. And hopefully we get to that goal.
Yeah, and that really helps, I think, to create the notion within your organization and what you're doing at Microsoft and at the state level for people to really understand that those ideas can come from anywhere. But it's about how do you take those ideas and then put them into action, whether it's a process innovation or an actual high-tech thing like we saw last night at the lab, which was really fascinating to see some of the surgical procedures that are being invented that can customize, each individual's knee in a surgery so that the surgeon isn't just, doing something cookie cutter. It's built for your knee. So I think that's really fascinating. I'm curious to know, Paula, you started talking about some of the things around, getting kids involved in STEM and some of the things that you're doing at Microsoft and at the state level to get people excited about health tech innovation and just innovation in general. But what are some of the other things that we can start thinking about, building out, and just things that will really add value to the journey that we're on and continue to catapult things forward? I'd open that up to any of you. We can start at the end of the line or in the middle, it doesn't really matter, but I'm curious to know about.
I'll start. So I have an anecdote from last night checking into my hotel. I was accidentally wearing my badge. I didn't realize I had still attached my badge to me. But the woman checking me into the hotel was like, the Biotech Center, what is that? What is it? And I was like, if you want a job in biotech, there are jobs available in biotech. I would be happy to tell you. I could go on for hours, but I won't because I'm checking into the hotel. But it's small interactions like that where you don't even realize you have a touch point with someone who may want to enter the life sciences or the tech innovation. So just be mindful of that at every opportunity, there is or could be a person who might want to learn. And then you can link them into something like our community college system. We have one of the best community college systems in the United States that can then lead people into either the 4-year degree or into the companies for whatever they need. And so it's really just an awareness at every level about how you can promote and how you can educate everyone from start to finish.
Anybody else want to add anything about adding value to make things?
I'll give a little plug for this book, since I brought a prop up here. Our digital products and services team is reading this. It's called Loon Shots. Loon as in lunatic. And it's about how you create a culture that can preserve that space for people to try really disruptive things that are probably going to fail. Maybe they'll fail for 5 or 10 years, right? A lot of the things that we bring to our lab, we're probably not going to adopt. We don't even do like fertility clinics, right? So why would we adopt a fertility product? But we're bringing it to expose and educate the community. This is a great book that just talks about protecting your thinkers. And I will say, even to the startups in here, you guys are so busy grinding away. Protect time for yourself to do that reflection, that creative thinking, to get feedback from mentors and others in your cycle. If you're just grinding away, you don't have time to think about moonshots and loonshots. So I love this. I'm learning a lot from it. It has a lot of case studies from military innovation and healthcare innovation. So it will be insightful for this group.
Yeah, and I'll just add from my own experience, we have a relationship, a strategic partnership with Johns Hopkins, specifically their innovation center, something we might be able to do too. And what we do is we help them identify ideas and IP from faculty, medical clinicians, and students that are eager to commercialize what they're building. And one of the ones, it's not healthcare related, but it's brilliant. These 2 undergraduate students started their company in high school and are still doing it. And they have developed an IoT-based system for identifying areas that are likely to have the wildfires in California and everything, and other areas like that. And literally, they started when they were like 15, 16-year-olds. They're now 20, 21, and they're commercializing it. And this is something that, while it came through Johns Hopkins, it's not healthcare related, but those are the types of people that help us democratize, that help us open up innovation, and these programs support support those types of innovative thinkers at any age, really. So it's just kind of interesting.
I'll just add one more thing if I can. Innovation is not all about the robots and the technology. We all know that. We have a program called Remarkable Ideas at Novant where if you're a nurse and your suggestion, your remarkable idea is to move a crash cart from one side of the room to the other because it makes the team more efficient, we reward that kind of thinking too. So even those little changes can mean a lot in the life of our workers. And then I see Edwin Marshall here. He's one of our fellows. He's coming to us from our diversity, equity, and inclusivity team. So I have him on the team so that everything we're doing, we look through an inclusivity lens, right? We're making sure that our pulse oximeters can read through every color skin because most of them don't. We're making sure that we're providing this education to communities that are underserved and might not always have it. So innovation comes in lots of forms, I think, for us.
Yeah, that's right. Dave?
I'll just, if I can close, I guess, on the question. I think in order to continue to add value, this is a charge for everybody here, everybody in the audience. It's to continue to build that proverbial forest that is our ecosystem. Think of 3 examples right now. One, sorry about that. Paula, you just mentioned Smart Girls HQ. That's one of the companies we recently funded in our latest grant round. We were talking about AI platforms earlier. Amissa is a Charlotte startup that is developing an AI platform for Alzheimer's care. They're to deliver better Alzheimer's care to deliver better care to patients with Alzheimer's disease. And just last week, I was meeting, I think I see him, so I'll point him out. I think Kevin Clark, who's in the lounge right now, from Point Motion. He was connected through me, through some folks at the Wake Forest Innovation Corridor. And I was like, there's a great conference next week in Charlotte. And he's like, I'll be there. And so I think it's literally those kinds of connections, continuing to build that. This is, we can talk about resources and we can talk about changing policy, but if we're really going to add value, and if there's something we can all do at the individual level, is to continue to build that forest. Plant, seed, grow, and so forth.
That's great in terms of thinking about connectivity. So I think the last thing I would ask is, what do you think kind of the 10, 20-year vision state of, digital health and health innovation is going to look like? I mean, obviously you don't all have a crystal ball, but I'm curious to know what you think sort of the next 10 to 20 years is going to bring to, whether it's payers, healthcare systems, the tech space. I mean, just curious to hear what your thoughts are on that before we turn it over to the audience for questions.
Well, we are opening a $180 million facility in Ballantyne that's going to have some homage to the Hospital of the Future. In our lab, we're testing some Hospital of the Future technology too, like completely humanless check-in. Is Presage Security here? Yes, really cool technology. Through a camera that has AI algorithms that are confidential, can take a number of different vitals. So it can be through a phone, a Zoom call, you can come to a humanless check-in station. So imagine the time this will save for our understaffed clinical teams. So yeah, thank you for being here. Sorry for the call out. The Hospital of the Future and automating as much as we can, that AI for the supply chain, AI for workforce automation, machine learning for all sorts of things, dictation, things that are burdens to our workforce definitely will be in that space. And then robots. We've got robots in some of our facilities, one of which is a RoboCop, basically patrolling parking lots to make sure nobody is passed out in their car and so forth. But these will be in our workspaces as well, delivering crash carts, picking up garbages, cleaning during the night. So lots of automation in the Hospital of the Future. And 2030 is not far away, but I hope we see some of that soon.
Yeah, I think when I think about where we're going and where I hope we'll be in 10 years is to remove a lot of the barriers that exist that squelch innovation. One of the things that I see a lot, and I'm sure you do as well, is that we have innovative point solutions that take care of this thing or that thing or that thing. And so for a clinician, these are not easily integrated into their workflows. And so a clinician, if they want to take advantage of these things, it's that dashboard and then that dashboard and then that dashboard. And none of it really integrates elegantly and easily into the EMR systems that we have today. So my hope is that we come up with a standard or a way to improve interoperability so that all these terrific solutions that are being built become part of an easygoing, logical framework in which clinicians do their work. The other side of this is the aspect of clinical trials from a pharmaceutical perspective, and how do we take the technology that's available and make sure that clinical trials are more inclusive, they're cheaper, they're faster, and the outcomes are more reputable, more accurate. And so I think those two areas are ripe for innovation, and I'm hoping that those are the areas that we'll see. The final thing I will mention is I hope that in 10 years from now, we're not talking about trying to solve problems about sickness, but we're trying to prevent them to begin with. And what are we doing, as Joe Kaviter talks about, expanding the health span instead of just the lifespan? And so those three areas are probably top on my list.
Okay. Tracey?
So my points for the future are integration of systems across the board for the entire healthcare spectrum from primary care, because who knew we could do Zoom doctor visits, but we proved it can be done. Just imagine what 10 years more we can be doing with something like in-home care without having to go to the hospitals, but the hospitals are there for when you need them. But also for the decision-making points. So the AI and the machine learning can do things like pathology readings and really get into decision-making points and determination of things that we think the human brain can only do now. But I'm sure that in 5 to 10 years, we'll get that one step closer towards those decision-making points where the physicians are not enthralled to the machine, but have that as a resource. So that's really where I'm seeing innovations going.
Dave?
Yep, and I'll say at the state level, I'm sure Tracey, you probably agree, we're seeing, North Carolina's been a power force, in terms of the healthcare sector. But what has traditionally been the healthcare sector, the biotechs, the pharma, the medical device, it's changing to include more and more companies in the tech and digital space. For example, if you've got a smartwatch, BalanceCell is a company out of NC State, I believe it's NC State, that developed the vibrating mechanism that was widely used in Fitbit for a long time. That's healthcare. We're moving away from just sick care to healthcare, and those applications are being seen in the tech space, the digital space, the material space, and so forth. We've got another company we work with, Collaborations Pharmaceuticals, that uses machine learning to look at existing drug compounds and how they can be repurposed to treat other drugs. I mean, that's a massive, massive way of looking at innovation. Rather than sitting in a lab and having to develop new compounds by yourselves, you've got a machine doing it for you. And that's what we're seeing at the state level as well. That it's not just the traditional healthcare sector that we would think of as in a hospital, but it's being seen on a much broader level.
Make one more point on that.
Yeah, please.
Just you made me think of another statement of the obvious, which is precision healthcare, whether it's for training for the NFL or pharmacogenomics, to make sure we're giving you not the one size fits all, one pill fits all, but something that you're going to have the proper reaction to. Precision healthcare that's using your stem cells to print a new vein or organ for you, from you, for you. The 3D printing that is modeled after your body, made for you from your anatomy. So that real precision healthcare, using RPM, using AI, using all the technologies we've been talking about. I think that'll be what customers demand, right? We want a text message when it's our turn to go in. We want our doctor to know us and our continuum of care, and we want the best thing for our bodies, knowing all of our social determinants of health. So, last point on that.
Thank you. Those are all really awesome things to look forward to the future. I look forward to that precision healthcare. I think that's a really winning thing for every human being to have an individualized health plan, because we all operate differently, and we're all very, very different in all different cultures. And so hopefully that would be the move for the globe to try and go towards that. So looking forward to that. So now we're going to turn it over to the audience to ask a few questions. So we'd love to hear from you all. give Ashley a couple seconds to bring you the mic.
Hi, everyone. My name is Igor Gorlatov. I'm with Kepler. Thank you so much for this panel and also for amazing work that you guys all are doing. I have a question in terms of capabilities that are missing in your organization, so capabilities that you are working to build. So what is something that you need that could help you scale innovation 5 to 10% faster than you're able to do now? What's this missing ingredient that you need? Thank you.
It's a great question. I'm so curious to hear what you all have to say.
Money.
Money. Is Christmas coming early? I'll tell you specifically what our office would like. So like I said, we look at companies that are winning small business innovation research, small business technology transfer grants from the federal government. We get them to a point so that once they've built their prototype and can prove that research concept with the federal government, we get them to a point and give them an injection of cash to help put them on a path towards commercialization. Often this funding still isn't enough. You're all in the tech space. You all know the need for resources. So if I could have my way, and I'm sure if I could speak on behalf of our board, we would love to have a next phase of that similar type of program that would say, okay, now that we've got you on that path towards commercialization, you still have a long way to go before you're actually commercially successful. So if we could give an injection of cash there, I think it would be a major win for the state.
Anybody else?
Yes. Second, and maybe even more importantly, is a clinical champion. I think Noah Walker is here from our team. He spends his days in and out talking to our clinical champions, because if our innovation team finds the coolest thing and we get it funded, which we have some examples of this with grants from the Duke Endowment, if I don't have a clinical champion who's going to teach their team the workflow and adopt it and say, this is worth my time to spend a few nights a weekend to get it done, it dies. It really does. And we've had to sadly learn that the hard way. So a clinical champion, and what that really means is time for our workforce to take time out from their very busy schedules. So we're working with our institute leaders to try to create something where they get compensated for enabling our innovation through just a couple hours of consulting a month. Like just a little bit will go a long way.
Yeah, we do that, and we are building a program. Actually, it's called a mentor program. It's probably very common for everybody. But within the startup program, we've identified and people have volunteered within Microsoft to spend time with startups. And some of them are industry focused, some of them are technically focused, some of them are business development focused. But the startups can go in and pick the people that they want to meet with to get that one-on-one help. And so that's really helpful. We also would like more budget so we can put more startups through the program. And one of the things that we are doing is we're starting to provide additional resources outside of Microsoft for our startups in the program, where we might provide a third party, like OpenAI is a third party that now our startups have access to their tools. I know Microsoft owns LinkedIn, but we just made a relationship with LinkedIn, so now our startups can have premium access to LinkedIn and those types of things. And we're always looking for the next tool that we can provide to make their journey a little bit easier.
Tracey, do you have anything to add about things that you would need besides money?
I guess I want everyone to be an innovator, to open up that innovation thinking, because the ideas are out there. It's about accessing them and getting people to think about their problem, how you would solve it, and does it solve a bigger problem within any organization. So really just opening people's brains to innovation.
That's great. Thank you. We have time for one more question. So is anybody else? I think somebody in the back there.
Sure. Hey, I'm Jorgen from Stroll. So yeah, thanks for having us along. We're from London, the UK, so I'm really happy to be here. Paula, you mentioned something really interesting about rewarding people for innovation and anyone in the organization, and I think it's something that's really interesting. As as a startup, we're thinking about that already, but in a huge organization like Novant, how do you do that? And do you just reward people financially, or how else can you do that to then create that culture of innovation?
So in one way, yes, we're giving $500 for any remarkable idea that the organization brings to life. That's, that's probably dinner out for this crew, right? So it's not a big incentive, but people are motivated by it. Second, we're creating this fellows program, so you'll get a little break, and the organization is going to support it. There will be other opportunities for zigzagging, our CEO calls it, where you can get out of the clinical space for a while, come and understand what digital products and services does, right? Or embed with the innovation team to learn about design thinking so you can take it back to your surgical services team and help create change there. So that little bit of time off for them is incentive as well. We're just trying to include our team and make them feel empowered by this. And I think we just get so much positive feedback that it's like a breath of fresh air to be included and acknowledged and to be asked, what are your ideas? Well, first of all, what are your problems? And then we work together to find solutions. So just that enablement and empowerment and feeling of respect, I think that's priceless.
Does anybody else have anything to add on that? That's a unique idea, I think, and really is important in all of our organizations to think about rewarding innovative ideas because that keeps the pipeline going for other people to succeed. Well, thank you so much. I think we are at our time. And so I would just love to thank all of you for being part of our panel. So if you want to connect with them, I know they're all on LinkedIn and they're in our programs. So you can certainly catch up and ask additional questions of our panel. And we're going to be joined next by our fireside chat with Dr. Mukamala. So really excited to hear what the doctor has to say as well. So thank you so much, everybody.
Yeah.